Hey everybody, Thomas from Precision Physical Therapy and Sports Rehab, talking to you today about gluteal amnesia. So in the blog article this week, we talked a little bit about the phenomenon of gluteal amnesia, or the tendency for certain muscles in our body, that article was just talking about the glute muscles, to maybe become inhibited or kind of lose their ability to fire when we need them the most. So why are we talking about those muscles? They're very important. The lack of those muscles firing to the best of their ability has been implicated with a lot of different things, including ankle pain, knee pain, even back pain. So I wanted to show you a quick way that you could go ahead and wake those muscles up, which will be beneficial for maybe preventing some of those injuries that can happen if those muscles aren't doing what we need them to do. This is a good exercise that's been determined by EMG or electromyograph studies to be really good at activating those gluteal muscles without activating a lot of the opposing musculature. Okay, so it's called the bird dog, and it's in a position called quadruped. Quadruped, we're on both hands and both knees. So all you need is a little bit of room to get down on your hands and knees. Try to get your knees under your hips and your hands underneath your shoulders. Keep your head in a good neutral posture. What you're going to do, one of the easiest ways to do it is you're just going to lift up one leg. Advancing that exercise, you're going to lift up we'll just start with your left leg and then your opposite arm. The whole time what you're trying to do is maintain what we would call a neutral spine position. So you don't want to get a lot of motion through your spine. You want that motion to be isolated more towards your hip. Try to control. You're going to feel like you want to tip over. Don't let yourself tip over. In addition to firing the glute muscles, I don't fire those deep spinal muscles. We call them multifidus muscles. And so it's a good overall exercise. What you want to do is link together about 10 on each side. So that would be 1 on each side. So give that a shot. 3 sets of 10 is kind of a common prescription of exercise, so that's a good place to start. You could advance it by holding longer, changing onto more of an unstable surface underneath your knee and underneath your hand, and that's something we can talk about later. So anyway, I hope you enjoyed that lesson, and we'll talk to you later.